Welcome back to the Mountain Morning Show, where I'm pleased to be joined by Beth Armstrong of the People's Health Clinic. Welcome, my dear. How are you?
So good. Thank you for having me.
It's nice to have you here. We've got a lot to talk about. You have broken into summer now. And of course, with that, so many activities that the People's Health Clinic becomes part of. Much of that an effort to make sure that you're able to continue doing the work that is being done there. So give us a little background on what's coming, what's next.
So I always like to start, and thank you for having us on the show. It's a great help. So many people always tell me that they've seen me on the air and didn't know that we've do this thing or the other, so I appreciate that.
Yeah, absolutely.
So our mission is to provide quality health care for the uninsured of Summit and Wasatch County. And with that being said, Wasatch County, 30% of our population comes from Wasatch County, and I am of the belief that most of these people are on their way to work in Park City, and that's how they found us. So even though they live in Wasatch County, I believe that they work and provide services here for us in Park City.
Right.
So these are our neighbors, and recently they've lost their access to their Planned Parenthood office in Heber. So
essentially defunded by our current administration.
Defunded. So what we've done is joined with Planned Parenthood in the form of a memorandum of understanding, just saying that we want to increase our contraceptive care for our female patients, providing IUDs and other forms of contraceptive care for those patients who used to get it through Planned Parenthood. So working hand in hand with Planned Parenthood and making sure that there's no skip in care for those patients that they were seeing there. And they had a very robust office and patient visits. So
I think this is so important because, you know, as we get into some difficult areas of conversation, areas that people don't want to talk about, which, you know, include obviously abortion and other things like that. When we talk about those things and people are like, people get upset about, you know, of course, and one of the reasons why maybe some people looked to defund Planned Parenthood incorrectly, they forget the fact that often what Planned Parenthood was offering was contraception, so we never get to that point. Right. And that's so critical. So the fact that you guys are stepping up to that part of it is so important. Right.
It's been shown that less than 1% of any Planned Parenthood dollars have any correlation to abortion.
Right. So it was so much more about family planning and being safe.
Education.
And education.
Yes.
And yet people just shut that part right down and only see the limited scope of what they wanted to see.
And in the state of Utah, it's really critical that those offices existed because they did provide education that they weren't getting anywhere else.
Right.
There's just a lot of missteps now, and it's going to, I think that we need to step up and we need to make sure that we provide these young women with the right answers and with facts and choices and how to keep from getting pregnant in the first place. And a great success at People's Health Clinic is that we, over the past year, have seen a significant, about a third, decrease in a 33% decrease in pregnancies.
Wow.
And that's due completely to the our getting IUDs into our patients that are requesting them, or other forms of contraception. But IUD seems to be the contraception of choice.
Indeed. Wow. So important conversations happening every day, as we know. But there are so many other things that the People's Health Clinic does. And you guys, of course, if we just look at the last year, expanded the number of hours, getting more involved in other areas of health, including, of course, making sure that people are healthy to begin with and don't get sick. So many of these things that we should talk about. What's next?
Dental. Dental is my big push for the next 12 months. I believe dental care is paramount to your overall health.
Right.
So if you have bacteria in your mouth that's not being addressed,
it's going to your heart.
It's going to your heart. You're going to get sick. People die. So we want to make sure that we find a way to get every person in the county, in Wasatch and Summit, some dental care. So that's my goal.
That's
it's
a
lofty.
good one.
It's a good one.
It's a lofty goal.
It's a good one. And so I write a grant a week, and I will somehow find the way to get a chair in that office. I have dental providers that are willing to come in, so I have the volunteers available. It's getting the supplies and the dental chair.
Yeah, well, it's going to happen. We know your perseverance pays
I'll
off.
do it. I'll definitely do it. And then we have upcoming. So in order to do all of these great things that we talk about, taking care of those most vulnerable in our community, and you know, I believe that everyone deserves health care. I believe that you know, it's our right that we all are able to be healthy, and we have been doing the healthy lifestyles. So we're not just taking care of people when they're sick, but we're also educating them. And we think if we can educate them and they take it home and they eat better at home, then it's a generational effect.
Right.
So we're working with Summit County Community Gardens for getting fresh vegetables. We went and today is our vegetable day, so we'll pick vegetables, we'll bring them to the clinic, and then Wednesdays is our Women and Children's Day, and so it's a perfect day to bring vegetables in, and then we give them out to our patients. They just take them, and it's
That's great.
Yep, and we have great pictures of last week was radishes, and great pictures of baskets full of radishes, and the kids eating them. So it was fun. Yeah.
Well, and getting them to try some new things is always a good plan as well.
A lot of those were like, what are these beautiful things?
Right.
I have no idea what it. And so we also we don't just give them the food, but we also print up culturally relative recipes so that they can make radish salsa and radish soup, which is soups are big in our community.
Speaking of that, we are talking about the most vulnerable among us, which is typically our Latin community. A big part of that, they come from hither and yon. They come to Park City to work. They obviously are probably the lowest paid group, which is unfortunate as well, considering the hard work that's being done. Okay. But that makes them often some of your best customers. And with that also is, of course, the fact that our administration has been, unfortunately, arresting some of them. And this has happened, again, just recently. So talk about this.
There was an arrest last night. I had an email first thing this morning, so I'm sorry. I'm actually, that's where my head is right now.
That's where your head is. Yeah.
That's where my head is. And you know, the only thing that we can do, because they are, ICE is picking up individuals on old, I think the warrant that this gentleman was picked up on was more of like 14 years old.
Wow.
So they are picking them up on old outstanding warrants, and probably very legitimate warrants and reasons to pick them up, but they're old. And I think that every time this happens, it causes such a stir in our community and in their community. And this is summer, and the kids are out of school, and parents are going off to work, and children have to stay at home. There's not a lot for these young kids to do. I know that we're working on finding ways to keep our youth more engaged in the summer and finding projects for them to do. So I like the idea of having them go out to the community garden and help there.
I do too. Well, we have just a moment or two left. I think the key here is that you guys have continued to provide a lot of education here. You've brought in experts to try to help people if they do have some outstanding things, to get those taken care of. Because many of those things preventable. We've had people who just haven't renewed something. Right. Little things that may seem incidental, but to ICE, they're not so. And they actually have the choice, and we've talked about this, if an ICE agent feels that this person is in some way either a threat or is in other ways, in a position to be deported, they can do that, and they are choosing that sometimes on their very right of their own volition. Right. So important subject here, and you guys have continued to offer education in this regard. So
we're trying.
Thank you guys for that.
Yeah, but if they keep picking them up, we'll have to continue to fight the good fight. And it's all about knowing your rights, knowing what you can and can't do, and then who can help you.
Well, we know the People's Health Clinic can help, and we appreciate that so much, as always.
Thank you.
Thank you so very much, Beth Armstrong. Much more, of course, coming up here on the Mountain Morning Show. But in the meantime, do take a moment to think about your community and what the People's Health Clinic does. And if you can help, you can volunteer, or of course, you can certainly make a donation to them by going to their website. We've got a lot more coming up here on the Mountain Morning Show. We'll be right back.